Hello everyone, welcome to our new session of our course. This session will be on communicable diseases among refugees and outbreak control, surveillance and response. As you know, the impact of conflict on communicable diseases spread is well recognized, resulting from a combination of damage to critical infrastructure, including water and sanitation systems, reduced health system functionality, and, importantly, disruption to surveillance outbreak response systems. Overcrowding, malnutrition, and the movement of large number of people in a short term are among the main causes of the spread of infectious diseases. For example, in the recent years in the EU, a number of communicable diseases have been reported to spread in the refugee population, including acute respiratory tract infections, relapsing fever, cutaneous leishmaniasis, diphtheria, scabies, measles, meningococcal meningitis, shigellosis, typhoid fever, hepatitis A, tuberculosis, malaria, and so on. And in this slide, it shows the numbers of papers identified in the systematic review by the different infection type among Syrian and Eritrean migrants. In 2013, the WHO declared a hot cluster of cases in Syria with wild poliovirus type 1, found in 2 of 18 cases of reported AFP, with subsequent spread to Iraq. Health response was directly initiated by a variety of health actors who were involved in immunization day campaigns, in addition to 16 countrywide and localized campaigns in Syria. WHO, UNICEF, and the World Bank collected relevant data to vaccination record and found a steady decline in routine vaccination coverage in years of Syria war. Factors that have worsened the polio outbreak were the country critical setting due to ongoing conflicts in both Syria and Iraq, what left many children born during the war unimmunized against many communicable diseases, including polio. And actually, in this slide, we can see clearly the difference between the coverage rate that was officially announced before the crisis, which is in 2015. You can see the number of, before that, the official number, almost 100, whereas UNICEF or WHO mentioned two different numbers or different figures, which is 80 or 90%. And even with the three numbers, with the three different numbers, after 2011, that declined sharply to have, in some cases, or according to some estimate, less than 40%. Surveillance is an important tool for health management in humanitarian situations. Data gathered in health surveillance are subject to change. The indicators, source of data, and uses of information may differ depending on the situation. A comprehensive public health strategy has been developed by UNHCR and applies to emergency and non-emergency operations in both camp and out-of-camp setting. Refugees residing outside camps are more difficult to track and are underrepresented in UNHCR statistics. These hidden populations impose a real challenge for non-camp-based surveillance. One of these challenges is providing good access to needs-based, high-quality healthcare services to those whose residence status is not yet assured. Another one is the diversity of asylum seekers and refugees with regards to their reason for flight, for country of origin, for socio-economic status, and educational background, among many others. In many countries, however, routine data collection is unusual in healthcare setting for asylum seekers and refugees, and they are not included in the national health monitoring structures. Including asylum seekers and refugees in health monitoring is challenging for several reasons. The population is highly mobile. The location of refugee accommodation is not centrally registered and is often safeguarded by regional authorities. The group is diverse in language and may be skeptical about participating in research. Daily epidemiological data related to some critical health conditions should be collected, then referred to consultations for each syndrome condition under surveillance in primary healthcare facilities, in refugee or migrant reception centers. Any observation exceeding the expected by more than 2 standard deviations is a warning signal. A warning signal that persists for at least 2 consecutive days will be an alert signal. The signals are evaluated in terms of public health significance, and then actions are made accordingly. This slide gives sort of activities or suggested activities to address communicable diseases. One of them is to improve global access to safe water, adequate sanitation, and improved hygiene. Also, reduce healthcare-associated infections. It's important to ensure broad immunization coverage and reducing antimicrobial resistance, in addition to improve food safety, also to prevent and control zoonotic and vector-borne diseases. Additional steps should be taken into consideration when addressing an emergency situation. Incomplete vaccination is one of the most prevalent issues. Besides, vaccination schedule may differ between country of origin and the host country, leading to higher risks of contracting diseases. Other major challenges, in addition to insecurity, logistical, and access issues faced in emergencies, are insufficiently trained staff, insufficient supplies and equipment, communications issues, and perception within the host community. The last one is limited camp capacity after massive population influx. The WHO Strategy and Action Plan for Refugee and Migrant Health outlines 9 strategic areas and 5 indicators to monitor its implementation. Among these strategies or the strategic areas are establishing a framework for collaborative action, advocating for the right to health of refugees, asylum seekers, and migrants, addressing the social determinants of health, achieving public health preparedness and ensuring an effective response, strengthening health system and their resilience, preventing communicable diseases, preventing and reducing the risk posed by non-communicable diseases, ensuring ethical and effective health screening and assessment. And the last strategy is to improve health information and communication. It's really important to mention that one of the most effective interventions done in this regard, when talking about controlling communicable diseases, and the main response is to do immunization campaign. This is important to protect displaced and the host population together. In cases of frequent population movement and instability, mobile clinics have been used to effectively achieve high vaccination coverage. Thank you, and I really would like to encourage you to watch the other videos of this session and to read carefully the two articles, two suggested articles, and the recommended one. Good luck.